Well, here on Voices, we want to help protect your family, which is why every Tuesday the doctor is in with our Ask the Pediatrician segment. Dr. Steve Turkovich, president of Oishei Children's Hospital, is here. We didn't scare you away last time. Thanks for coming back.
Thanks for having me.
We appreciate it. Some good questions here. We're going to start with the first one from Maki. It has to do with COVID, which we were just talking about there. And really this question about, in this sort of post-pandemic era, how do you know when, in terms of sending your kids back to school, what the right timeline is if they catch the virus?
So just like we just heard, fever is one of those real important symptoms. So you want to make sure you're fever-free for 24 hours prior to going back. If there's any vomiting or diarrhea associated with your symptoms, you also want to make sure those are gone for 24 hours. And if you're on an antibiotic for infection, you want to take that for at least 24 hours before going back. And then finally, parents know your children best. When you feel like they're ready to go is the best time to go back.
Great. We got a couple of really good questions here from a viewer named Erica. And the first one, she says, I have a picky eater. How do I encourage variety in his diet? And when should I be concerned about vitamin deficiencies? We talked about the vitamin D deficiency when you were here last time, because that's a sort of a concern this time of year.
So picky eaters is a very common thing. My advice to parents is always be patient and stay calm. Okay. Kids really, it will take them about 5 to 10 times to try something before they decide if they like it or not. So you want to involve them in meal prep. Make meals scheduled but non-confrontational. The more confrontational they make it, the more picky they're going to be. Give them choices. Pair something they like with something maybe they may not like. And if they feel like they have control and they're part of it and it's a positive experience, usually you can break through that pickiness. If you're really concerned, talk to your pediatrician, and you can always give a multivitamin once a day.
And then the other question was about you just touched on that, sorry. Erica also asked, what essentials should I keep in my home first aid kit? Erica, giving us all the questions tonight.
All very good questions. Yeah. So there's a couple different categories. For wounds, you want to make sure you got bandages. You have things to clean the wound, so antiseptics, antibacterial ointment. Those are really, really important. For lacerations, especially ones that can be pretty big, a tourniquet. For injuries, you want ACE bandages and ice packs. And then you also want to make sure you have things like hydrocortisone cream if you have a localized allergic reaction to something.
We talked not too long ago about, cold and flu season, and I know it was anticipated to be a pretty bad one, right? Mm-hmm. We had RSV, we had flu, COVID is still around. Yep. Have we made it through the worst of that, and what is it looking like now? As I mentioned this last time, as you're still seeing patients, is it still bad?
Well, we're actually starting to see the second wave of influenza come, which we do see every year. Usually influenza A, which is the strain of the virus, comes first, and then about a month or so later you see influenza B. And looking at the data that we saw last week in the hospital and what we're seeing, volumes are going up, the ED is getting busier, and we're starting to see that increase in influenza B. So it's never too late to get your flu shot.
And then finally, it seems like all the time different viruses and stuff are going around. I mean, what are you seeing? What's most sort of concerning right now at Children's and at other pediatrician offices around the region? So
a couple of things. We're seeing some influenza B, rhinovirus, which is the most common cold virus, is starting to increase, and that kind of goes up and down throughout the year. The other thing that we're seeing quite a bit is pink eye. So pink eye is a bacterial infection. We're seeing adults and kids affected with it. It's a nuisance, but it does require some antibiotic eye drops that you want to take for at least 24 hours before going back to school.
Wow, pink eye. That came out of nowhere. Dr. Steve Turkovich, thanks as always. I want to remind everybody, voices@wkbw.com is the email address if you have questions, and we'll ask them to the doctor. That's going to do it here at 5:30. Thank you for joining us.